Chair recognizes the member for Vernon-Monashee.
Thank you, Mr. Speaker, and congratulations on your new role. I would like to begin my response to the throne speech by acknowledging that I'm virtually joining this session from the unceded territory of the Okanagan Indian Nations, and I thank them for their stewardship of this land. I am a new MLA representing one of the most beautiful constituencies of Vernon-Monashee. I would like to express my gratitude and thank the constituents of Vernon-Monashee for electing me to be your MLA. I am truly honored, proud, and excited to be your representative, and I take my responsibility sincerely. I thank all the voters for practicing your democratic right, regardless of who you voted for. Congratulations to all the members of this House on your election and re-election. No campaign is ever possible without the volunteers. I am so thankful to my incredible team of volunteers, donors, and supporters who have made our historic win possible with their hard work, dedication, and enthusiasm. I would like to take the opportunity to thank our previous MLA, Mr. Eric Foster, for his service, and I thank our two other candidates. It takes lots of courage, passion, and commitment to step forward to run for the office. I thank my family, including my wonderful husband, Baljit, my teenage daughter, Manri, who is a second-year science student at UBCO and wants to be a doctor to serve people in rural communities. My middle daughter, Jasreen, who can speak 4 languages since she was 8, and my 5-year-old son, who gets adored by his sisters so much, and he's ready to start his kindergarten this year. My kids have happily and proudly made many sacrifices and adjustments due to my busy schedule. I am profoundly grateful to my mom for being my rock, who stood by me during our good and tough times, who taught me to fight for my rights and for the rights of others. My mom made sure my kids were taken care of when I was busy with work and campaign. She also made sure that hot meals were ready for me and for my family, despite having her own health issues and not being able to stand for extended periods. My mother and my late father instilled in me the values of respect, kindness, and hard work, helping others and being the voice for the vulnerable people in our society. My parents have helped me to be a strong, independent, and empowered woman. There are 2 incredible men in heaven who are watching over me today and have helped me tremendously to be who I am and for giving me the purpose to always strive to do better and to be a passionate and caring human being. I am talking about my dad and my late husband, Sammy. Mr. Speaker, I want to acknowledge our longtime volunteers, Mr. Lauren Adamson and Mrs. Jane Adamson, who have been volunteers for the last 42 years. Both Lauren and Jane volunteered doing door knocking and various other roles on many campaigns with their 2 babies, Kevin and Mary, who are adults now. This is a great and encouraging example of the true dedication, commitment, and determination to stand strong for the values we believe in. Thank you, Lauren and Jane, for years of your hard work and dedication. Finally, your sincere efforts, along with many of our wonderful longtime volunteers and supporters from Vernon-Monashee, came to fruition. I also like to give kudos to our wonderful and hardworking staff at the legislature, including my LA Pavanpreet, for their tremendous help. I look forward to meeting you all in person. I would like to thank and proudly acknowledge my amazing and hardworking staff members at our Vernon constituency office, Emily and Josh. Josh and Emily worked tirelessly with so much passion to help people of Vernon-Monashee. Thank you both for your dedication and enthusiasm you show every day to work for the betterment of people and our constituency. I acknowledge and thank our frontline workers, including paramedics, doctors, nurses, therapists, care aides, and many unsung heroes, our housekeeping staff, support staff from dietary to lab techs, imaging staff, porters, administrative staff, and many more. I would also like to extend my sincere appreciation to our essential workers in retail, trucking, farming, trades, hospitality, small business, and volunteers with nonprofit organizations. Also, daycare workers and our incredible teachers for continuing your work and dedication during these unprecedented times. I was so reassured that December throne speech was focused on investing in people, their health and well-being, to promote the vital services we all rely on, such as healthcare and seniors care. The throne speech also focused on economic well-being and support for local businesses and individual families. In December, I was surprised by the words from member of Kelowna Mission. I quote, "We need more healthcare professionals that can advocate for patients and deliver the absolute best care possible, not just more nurses," end quote. Member also mentioned, I quote, "I don't want an MRI. I don't want or need a new MRI," end quote. I would respectfully like to share my thoughts as I come from healthcare background. I hope the member understand that nurses focus so much on preventative care. Nurses are the biggest advocates for their patients, and in fact, it's one of their nursing standards that they must meet. Furthermore, nurses are trained to look at the patient as a whole. For example, when myself or my colleagues go to do wound care, we look at patients' diet, underlying medical conditions, living arrangements, their mental and physical well-being, and whether they need more supports. Nurses always provide emotional support to patients and their families, even when patients pass away. Community nurses make condolence calls and even send cards to the families, connect them with grief counseling, and many other resources as needed. Nurses work with patients from birth to the end of their life and anything in between. Nurses work in nursing homes, community outreach clinics, harm reduction centers, mental health, and telehealth, and so much more. They work in public health, taking care of newborns, teaching parents how to take care of newborn and toddlers. Nurses do outreach work in schools, and this is all part of the preventative care. I worked as a proud registered nurse in rural areas, acute care, surgical nursing, community nursing, palliative care, and most recently, up until November 15, on a COVID unit. Over the last 16 years, working with 2 different health authorities and in various healthcare settings, along with many of my colleagues, I have personally witnessed and lived through the massive healthcare cuts, austerity, and privatization from the BC Liberal government. My LPN colleagues and many hospital support staff in healthcare struggled financially due to the massive 10% wage rollbacks under the BC Liberals government. I have witnessed my coworkers breaking down in tears and crumbling when they were constantly understaffed and overworked. I was also one of them. And that is before any mention of the violence nurses face in healthcare. Therefore, I appreciate our government's every sincere effort that has been made during the last 3.5 years. One can blame, point fingers, find faults, nod heads, wave their hands, or criticize the efforts, or even try to take credit for some of the things they want. But the reality is that healthcare workers can tell firsthand when cuts are implemented and when more services are being added, because it makes enormous difference in their working conditions for their physical and mental health. and most importantly, the quality of patient and seniors care. We still need many more nurses to fill the gaps that were left until 2017. The members' remarks were concerning to me and to many others, especially coming from our healthcare critic. I would like to request that our government continue with its progress dealing with this chronic staffing shortage. I thank our government for hiring many more nurses in mental health and substance use areas, as this has been a great resource to refer patients to highly dedicated teams. I am grateful for our government for giving us an MRI and urgent care center in Vernon-Monashee. Prior to this, we had to send patients to Kelowna, and they had to wait for too long in order to get their MRI done. We also had to book patient transfer teams, and most of the times nurse had to go with the patients. Then we had to backfill that nurse, mostly on overtime. So imagine the amount of money we had to spend on patient transportation, having extra staff or leaving existing staff working short when we were not able to backfill that shift. We were spending way too much money by doing so, and the patients were suffering from long wait times, delayed diagnosis, and treatment. This also had a major impact on the patient care in Vernon due to short staffing when we were unable to backfill the staff. Having MRIs widely available is a proactive approach. My mom had her MRI done recently, and she only had to wait for 8 days, and her appointment was at 7 p.m. My father-in-law had his knee replacement done in October during COVID, and he didn't have to wait for long. And he received exceptional care, which he's so grateful for. Improvements and investments in services like healthcare, mental health, and seniors care are some of the best investments any government can make. Investments to deliver better care for seniors, stability and safety for long-term care workers will hugely benefit my riding. We have many seniors who have worked hard all their lives, and it is our turn now to give them the support and quality care they need and deserve. We do have much more to do, and I am confident that having a dedicated group of people in this house will focus on working together, as all of us are here to serve our constituents and make lives better. Mr. Speaker, the BC Recovery Benefit will help many families in many ways. When we go through financial hardship, every penny helps. I have personally talked to hundreds of people since the day of my election via emails, messengers, and phone calls. People are so grateful to receive the recovery benefit. People who I talk to are living on fixed income, some lost their jobs, some are on disability, and some are unable to go to work due to compromised health and other struggles. Farmers in my constituency also have had challenges due to the labor shortages, and with early snowfall in October, they were not able to harvest all their crops. They lost their produce, and this was heartbreaking to witness. I am pleased by our government's announcement of Small Business Acceleration Pilot Program by offering up to $800,000. I am reassured that farmers in my constituency will benefit from this. I belong to a farmer family, and I have witnessed hard work, sweat, and tears farmers have to shed in order to bring food to our tables. Talking about farmers' community in Vernon-Monashee, I would also like to take a moment to acknowledge the unfairness and ongoing injustice farmers in India are facing. The suicide rate among farmers in India is the highest in the world, which clearly reflects the lack of support towards these hardworking farmers. I would like to ask all members of the House to please acknowledge and support farmers in India for their democratic right of peaceful protest and to have their voices heard. Farmers all around the world deserve all the respect, support, and advocacy we can offer to them in order to promote food security. Our government's commitment to expand childcare and early learning to create jobs, stimulate the economy, and make sure children can have the best possible start in life is much appreciated effort by many parents. The nurturing care and investment in early years of child's life leaves a lasting and positive impact. This also enhances their mental health from early on. Investing in children is investing in BC's future. Our government's announcement of opening new childcare centers in Vernon and Coldstream is going to help many parents in Vernon-Monashee. This fall, our government released a robust economic recovery plan, which is already supporting businesses. Tourism, farming, and small businesses are some of the major contributors to our economy in Vernon-Monashee. Steps taken by the government to support our businesses through property tax cuts, deferred tax payments, and BC Hydro rate relief, and small and medium-sized business recovery grant are much appreciated. I have had the opportunity to meet many business owners like Sue in my constituency, and they're grateful for these initiatives. Sue had asked me to thank our Premier and the government for these initiatives. I am glad that our government's recovery plan will be guided by our core principles, including climate action and reconciliation with Indigenous people. I appreciate the announcement to provide millions to childcare providers, school boards, and health authorities to help them deliver COVID-safe care and renovations to create more spaces. Our government has delivered hundreds of affordable, supportive, and accessible housing units in Vernon, and these have changed many people's lives. I greatly appreciate the recent announcement of more affordable housing for Vernon and area. This is going to benefit many more people by helping them to find a home. I thank our government for paying attention to this long overlooked and ignored issue of affordable housing in Vernon-Monashee. I thank Dr. Bonnie Henry, our health minister, and their dedicated team for effectively dealing with this pandemic. I understand many of the decisions they have to make were not easy, but I also know that Dr. Henry and her team always have people's best interest at their heart. Let's continue doing our part as we all have done the last year, so we can overcome this crisis together. When you're upset about having to wear masks or not being able to have gatherings, please take a moment to think about our healthcare workers who have to put on their masks for extended shifts and for days in a row, along with full-on PPE, including non-breathable gowns and gloves. Please take a moment to think about vulnerable seniors who are living in isolation for months in the hopes of having this pandemic go away. Think about the thousands of people who have passed away due to COVID and their loved ones. A couple of people have said to me that we have an opioid crisis and people are dying from heart attacks and other chronic illnesses. Yes, I absolutely agree with you. And I can reassure you that our work and care had never stopped for people with addictions and to treat chronic illnesses. It is reassuring for me to know that our government has made sincere efforts to address the opioid crisis by creating the first ever mental health and addictions ministry, by hiring many mental health and substance use teams, creating harm reduction sites and outreach clinics, and much more work is underway. More recently, additional funding was allocated to more treatment spaces to address addictions and mental health issues. We are getting 8 additional beds in Vernon-Monashee at Bill's Place to help people in need. As a healthcare professional, I confidently share with you that we have never lessened our efforts towards the opioid crisis or to take care of patients with chronic illnesses. We will continue to do more, and I am fully committed to continue my advocacy to address the need for more resources in Vernon-Monashee. At the end, I would like to remind everyone what Dr. Henry says. This is now, not forever. We are in this together, and we will get through this. I would like to end my speech with my favorite quote from John Mark Green. Everyone has a history. What you do with it is up to you. Some repeat it, some learn from it, and really special ones use it to help others. I thank you all from the bottom of my heart for doing your part, for making many sacrifices and adjustments in your lives to deal with this pandemic. We have hope on the horizon, and there is a light at the end of the tunnel. I hope 2021 will be kinder and better year for everyone. Stay safe and stay healthy. Thank you. Thank you, Honorable Speaker, for giving me the opportunity to speak.